Hello students, welcome back to another learning lessons to our Physio-Pulse channels. In today's lectures, we'll discuss about the GFR, that is glomerular filtration rates, in a simple, conceptual, exam-oriented manner, specially designed for undergraduate students. So let's get started our today's lectures. Actually, GFR, the rate of filtration in glomerulus in each minute in all the nephron by both kidneys called the glomerular filtration rate. So this is the GFR, which is normal average is 180 liter per day. So if you see in 24 hours, the filtration is 180 liter, that is 125 ml per minute, or 20% of the renal plasma flow. But 99% will be absorbed from the filtrate, but only 1% excreted through the urine, that is 1.5 to 2 liters per day. So most of the filtered water must be absorbed or reabsorbed, or death would be ensured that lost of the through the urinations. But question comes, the GFR, when it is increases, or when it is increases, or when it is decreases, but what are the factors which are responsible for the increasing or decreasing GFR? That we will discuss consequently. But one thing is to understand that if GFR is too high, what happened? Or if GFR is too low, what will be happen? So if you see, when GFR is too high, the fluid flows through the tubule too rapidly to be absorbed, and it will be lead to the urine output rises and create threats like the dehydrations, electrolyte depletions. So if GFR increases, filtration increases, then that means it creates the threat of a dehydrations or electrolyte depletions. Whenever if GFR is too low, that means it's sluggish to the tubules. The fluid does not come rapidly, so it leads to the tubules reabsorb washed materials, and that should be eliminated. So this type of disease will be happen in case of GFR is too low. So if you see a diagram, well, we know that the 20% of the cardiac output it comes through the afferent arteriole for the filtrations, but from this 20% of cardiac output, that 80% also goes to the efferent arteriole, but rest 20% volume that can goes to the Bowman capsule through the Bowman capsule's proximal convoluted tubule, then looks apparently and even also distal convoluted tubule. So in this way, it is also filtered. A filtrate is filtering here is the glomerulus, then the filtering membrane, and through this spore, some permeable substances they can filter here. Now, glomerular filtration depends on the following things. Actually, first of all, pressure gradient across the filtration barrier, that is glomerular hydrostatic pressure, which is 60 mmHg, which promotes the filtration. Secondly, hydrostatic pressure in Bowman capsule is 18 mmHg. It opposes the filtration. That means it can prevent the filtrations. And number three, colloidal osmotic pressures of the glomerular plasma protein, that 32 mmHg. It also opposes the filtration. So if we calculate here net filtration pressure NFP, that is 60 minus 18 plus that is minus 32, that equivalent to the 10 mmHg. So pressure gradient across the filtration barrier is that is net filtration pressure 10 mmHg. But in case of blood circulation throughout the kidney, if you see RBF, renal blood flow through the kidney, 20% cardiac output, which I already discussed here, and renal plasma flow through the kidney is about 650 ml per minute. So GFR is about 16 to 20% of renal plasma flow. That means it is 180 liter per day. So in this way, you can calculate GFR rates. Number three, GFR glomerular filtration depends on the permeability of the filtration barrier. This is the three layers. These three layers, the endothelium of the capillary, filtration sheets, that is the epithelial lining on the Bowman capsules, that is called the podocytes, and basement membrane. And number four, filtration membrane surface. So any changes in these factors will lead to change the glomerular filtration rates. So if you see the factors affecting on Starling law or Starling forces, that means glomerular hydrostatic pressure of Bowman capsules, even colloidal osmotic pressure of glomerular plasma proteins. So they all are increased GFR or decreased GFR. How they increase or decrease, that I will discuss here. So glomerular hydrostatic pressure is 60 mmHg, which can promote the filtration. That means it increases the GFR. Increasing the arterial blood pressure, even also afferent arterial vasodilations or moderate efferent arterial vasoconstriction, which leads to increase the GFR. And even if you see the decrease by GFR, that is afferent arterial vasoconstriction, efferent arterial vasodilations. Secondly, hydrostatic pressures of Bowman capsule 18 mmHg, which can oppose the filtration, that means increase by decreasing of GFR. That is urinary obstructions. If it is increased, then GFR decreases. Kidney edema increases, then GFR decreases. Colloidal osmotic pressure, that is 32 mmHg, it also opposes the filtration. That means when it increase dehydration, then GFR decreases. Then decreased renal blood flow, that means it can increase. That is opposite infiltrations. And in this way, you can say some factors which are affecting on Stalin law of the forces, that can depend on the GFR. Now, if you see the regulation part, how it can regulate it? If you see that regulation depends on the three important factors. That actually, if you see the mind map, that the GFR is controlled by regulation of glomerular blood pressure through the three mechanisms. Number one, auto-regulation mechanism. Number two, hormonal regulation. Number three, sympathetic control, extrinsic mechanism. How autoregulation or intrinsic factors? There is the myogenic mechanism and tubuloglomerular feedback mechanism. And another way, sympathetic control, that is extrinsic factor, that has during the rest condition has no effect, but another condition like severe condition, there the decrease in GFR. So if you see one by one myogenic mechanism, that means it promotes the changing blood pressure by the stretching receptors through the increased blood pressure or decreased blood pressure. If increase the blood pressure, then it leads to decrease the glomerular hydrostatic pressure, therefore it decreases the GFR. So in this way it can regulate. And another way, if you see, whenever it decreases the blood pressure, that means increases glomerular hydrostatic pressure, which can increase the GFR. On the other way, tubuloglomerular feedback mechanism, that promotes changing the sodium chloride concentration in the distal tubule, which is decreases to the resistance to the blood flow in the apparent arterioles and increases the renin release from the juxtaglomerular cells of the apparent and inferior arterioles. So in this way, we can say glomerular filtration rate is also regulated. And these are also described here, autoregulation of GFR renal blood flow, as because we know that kidney can maintain the autoregulation through self-regulating mechanisms. So GFR also regulated in this way. And autoregulations already we have discussed. And some important thing is that hormonal control, that is the epinephrine, norepinephrine. These are the hormones. They can effects on GFR in influencing of the GFR. If you see, norepinephrine can decrease the GFR, and also epinephrine decrease the GFR. This type of hormones that can leads to decrease the GFR. Effects also angiotensin 2. Already we have discussed the when angiotensin 2 acts, it causes the constriction of the apparent arteriole, therefore increase the blood pressure, glomerular pressure, filtration rate, and reduce the pressure peritubular capillary, and reduces the resistance to the tubular reabsorption, and thereby tubular reabsorption will also increase, and even volume is less, but concentration is so high. So sympathetic control in the another controlling mechanism, extrinsic mechanism. During the rest, renal blood flow vessels are maximally dilated, so no sympathetic activation on that time during resting condition. But during under stress condition, norepinephrine is released, norepinephrine is released, and sympathetic nervous system and epinephrine is released by the adrenal medulla. So sympathetic nervous system also stimulates RAAS system, renin, angiotensin, aldosterone system, and this induces vasoconstriction of efferent arteriole. So these are the summary of all factors that can affect the GFR, like the Kf or constant, which can leads to decrease the GFR. Even these are also decreases GFR, the pathophysiological causes during this condition, and even also hormone we have also discussed here when GFR is decreased. So, so in this way we can conclude that today we have covered our particularly definition of glomerular filtration rate, the normal value of glomerular filtration rate, even also factors which are factors responsible for the increasing or decreasing the GFR, and moreover we also completed the regulation part, that is the controlling part of the glomerular filtration rate. So I think this lectures is very important for your exam purposes. Even also I'm giving here some MCQs, which is very important for your competitive exams. So thank you for watching this lecture. I hope this session has helped you understand the topic clearly. If you found this video helpful, please like, share, and subscribe to Physio-Pulse channels, and do not forget to press the notification bell so you never miss our upcoming lectures in physiology, biochemistry, biology. If you have any queries, any suggestion, and also comments, give some comment sections. And thank you for watching, and we'll see you in the next lectures. And until then, keep learning and also stay curious.